Hello, my name is Paul Thomas and I'm a family medicine doctor. I'm starting Plum Health Direct Primary Care, and we deliver affordable, accessible healthcare services in Detroit. You can learn more about us at www.plumhealthdpc.com. So what I wanted to talk about today is why healthcare costs so much. The reason is that when your doctor bills your insurance company for $1, that dollar is split among the insurance company and among the hospital to pay the CEOs, the billers, and the coders, and the attorneys on either side. So what happens with that dollar is it gets split off into different parts, and your doctor may see 30 cents of it. So let's give a real life example. You come in with pneumonia to see your doctor. Your doctor might bill it as a 99214 or a moderate complexity code, and that doctor might see $40 from that code because $50 goes to the insurance company and $40 goes to the overhead at the clinic or at the hospital. Now, there's nothing wrong with this, right? But what happens is that the doctor is being paid less and less incrementally. So incrementally, doctors are seeing more and more patients to make up the difference. And it eventually harms you, the patient. When you used to maybe get half an hour with your doctor, now you only get 10, maybe 15 minutes of FaceTime with your doctor, and you maybe only are able to ask one or two questions. With what we're doing with direct primary care, we remove those middlemen. We remove the insurance company, we remove the kind of clunky hospital system, and we distill it down. So now when you pay a dollar to your doctor is actually receiving that $1. So in our membership, we have our members pay $49 a month, and we actually receive $48. We have a 2% credit card fee, but that $48 allows us to take care of you when you need it. So it's no longer transactional. So let's say you get sick. Illnesses don't last for one day. They sometimes last for a week or 2 weeks. So if you need to come and see us 2 or 3 times while you're ill over that 1 to 2 weeks, it still costs $49 for the month. We don't bill you additionally for every time you come and see us because you've already paid your membership for the month. And that's what sets us apart from the traditional fee-for-service system. We really get to know you, we get to know who you are, and we get to learn about your health goals. We actually have time to listen to you, physically, emotionally, mentally, and we really get to understand where you're coming from, and we can even make house calls. So this might be a $20 surcharge on top of the membership, but because we have so few members, we can make some time in our day to make house calls when they're needed. So here's our break-even analysis, starting with a low overhead and growing by 15 members each month. We break even at about 53 members. So that would take us probably 4 to 5 months, conservatively. Now we plan to grow at 20 to 30 members a month. The industry average is 20 to 25 members each month. Additionally, when we have a larger office space with greater staff payouts and higher rent, taxes, and utilities, our break-even point will be about 150 members. Again, this is conservative estimates growing by 15 members per month. So what we need to do right now is raise $100,000. Currently, we've raised $50,000 from the Motor City Match, and we've raised $20,000 from private investors, and we're looking to add $30,000 more. I did want to mention that this is legal, and there's a line item in the Affordable Care Act. We are in compliance with the Michigan Senate Bill 1033. And then I wanted to mention that this is rapidly growing, so you may not have heard of this model. That's because 10 years ago, there were only 150 people doing it. Now there's about 5,000 people doing it in 500 practices across the country, 48 states and the District of Columbia. We're going to be the first one in Detroit and Wayne County, and we will be serving a lot of people who want this. So a direct primary care doctor created the website iwantdirectcare.com, and every red dot on this map represents an individual who said that they've wanted direct primary care. And since we'll be in Southeast Michigan, we'll have a big market of people who are ready for this sort of practice. So thank you for watching and listening. We are Plum Health Direct Primary Care. My name is Dr. Paul Thomas, and we're delivering affordable, accessible healthcare services in Detroit. You can learn more about us or sign up for our services at www.plumhealthdpc.com. Thank you so much and have a great night.